with that, I will bring you to the next topic, which is going to be treatment for COVID-19. How do you treat COVID-19 early treatment, not so much in the ICU care or ventilator care. And with that, we will go to Dr. Malotky. You are an expert in this. You have treated tell us how many few hundreds of these patients successfully, saving them?
Well, Paul tends to lay it on kind of thick. I started counting for some reason, and I was kissing on my 2-year-old grandson. I have his laryngitis, so I don't have the Rona. I started counting, and number 210 came to my house this morning to be treated for her COVID. So, yeah, it's a real thing, and it's been a scary thing. It's caused a tremendous unimaginable amount of collateral damage in my patient population from the fear. And so what I thought I'd do is I'd just tell you this little story about what happened to me. So when we first heard about this coronavirus, it was pretty apparent within the first couple of weeks to me that people were dying from this thing called the Cytokine Storm, which Dr. Orloff mentioned. And the Cytokine Storm is a little bit complicated, a little bit in the weeds, but humans are capable of 4 different types of allergic reactions. Most people have heard of anaphylaxis. That's where you eat the peanut and 10 minutes later your throat swells shut. Well, there are 3 other kinds of allergic reactions. Cytokine storm is a combination of number 2 and number 3. And it's kind of a overreaction when you get sick and your body knows it can't handle it. So it's really your own fault. Because if your immune system is not in shape, that's all you got. That's all you got for bacteria. Well, now we have antibiotics that help with that, but that's all you got. So if anything else comes out of this pandemic, it'll remind us to, take care of our immune system. So I've treated 30-year-old yoga instructors that were sick for 4 hours. They're like, so anyway, it turns out my son and my son-in-law, both of which are plastic surgeons, in February of 2020 were sort of out of the operating room because it was on elective procedures. And it begs the question, how come I don't look better? But 2 plastic surgeons in my family. So we were out on the lake catching bass, and I knew what was killing people. So I said, boys, this is the cytokine storm. All you got to do is give these people steroids early in the course of the illness, and they'll be fine. And no one has to die from this. And both of them looked at me. About 20 years ago, most of the med schools started teaching that steroids are bad, don't do it. Now, there's a lot of liability associated with them. There's a fairly large number of side effects possible from them, and that's all true. But they said, Dad, you're old, nobody uses steroids. Don't do that. So I just started doing it anyway. And then very pleasurable, that's the end of February, the second Wednesday in April, breaking news, genius doctors discover cure for coronavirus. It's IV steroids. I forwarded them the email. So that's what I've been doing. I try to get my people to the office in the first 3 days of illness. Do not lay in your house and have someone slide a pizza under the door for a week. Do not. The analogy that I've been using is the cytokine storm thing is like a huge mountain covered with snow. And I'm at the top, and I make a snowball, and I roll it down that mountain. Halfway down the mountain, size of a car. If you let it get to the bottom of the mountain, size of a house. The doctor's job is to stop that snowball before it gets to be the size of a car. And steroids stop it right now. And it costs $10. So yeah, that's all I wanted to say.
That's a lot. That's very powerful. Less is more sometimes, right?
Yeah.
Sometimes you put these patients on ventilators or. So, certainly there are some more treatments nowadays. There are newer pills are there, or antibodies. Just a quick mention of
Yes,
them.
couple quick treatments. So other really good and effective early, don't want to take someone else's thunder here, but the Ivormectum and Hydroxychloric one you hear about, which are sometimes hard to get. It's been hard to get depending on political issues, I guess, but they help. They're the biochemical name for those substances. They're zinc ionophores. So they help your cells pull zinc into their cell membranes. Viruses hate zinc. It's like kryptonite for them. So if your cells in your mucous membranes where this virus has to enter, can't enter through your skin and your leg, has to enter here. If there's zinc on those cells, the virus will not enter. Used early, tremendous help. Just hard to get. There are also 2 drugs that are right now being reserved for people who are at high risk. They're kind of similar to the drugs we use for HIV, for those antivirals, and I can't write a prescription for them yet. So, but they're ramping up production of those too. I think by the time they're readily available, we won't need them, I think.
Well, thank you, Dr. Malotky. We also have Dr. Amy Keurentjes here, who's going to also tell us what else can you do. So what else can the folks do to stay healthy, doctor?
Hi there. Yeah, thanks for coming out today.
Thank you.
So I'm Dr. Amy Keurentjes. I've been an OBGYN in Reading for nearly 10 years. I've been a doctor for about 14. I was a nurse for 5 before that. I have a PhD in global health leadership. And I've also taken a special interest in functional medicine, which is kind of finding the root cause of disease and, fixing that. And I've been treating a lot of people outpatient with COVID. So, it's funny because I have in my notes, don't gloss over my topic as a puff piece. But everyone's talked about it so far, how important it is to take care of your immune system. So it's really important. Pay attention. This information could save your life. This is just keeping you healthy. This is how to prepare your COVID toolkit and also just how to stay healthy. So let's start with vitamin D. People with low levels of vitamin D, less than 20, were over 90% more likely to have severe COVID. People with people with vitamin D levels over 30 were more than 90% more likely to have mild symptoms, according to some studies. So I recommend that you go get your vitamin D level drawn, and then you can kind of dose your vitamin D appropriately. I did talk to my nutritional therapy friend, and she said, you know what? We are lucky in Reading because we have so much sun. You're much less likely to have a deficiency in vitamin D if you live in Reading. So Dr. Malotky also talked about this one. The next really important one to make sure you're taking is zinc. Zinc is the kryptonite that he was talking about. It helps block the virus from multiplying. And some drugs like hydroxychloroquine are not nearly as effective if they can't get zinc in, if you don't have zinc. So zinc is very important. You need to take 50 milligrams to 100 milligrams of elemental zinc. So zinc sulfate, 220 to 440 gives you the right dose. Vitamin C is the next one in the toolkit. Vitamin C is always a good idea. It's an antioxidant, has anti-inflammatory effects. So for every day, take 1,000 milligrams. But if you start getting sick, increase that dose to 3,000 milligrams. It's a good idea to divide it over 3 doses. And if you start having diarrhea, just back off on the dose a little bit. That's your body saying, a way of saying, hey, that's a little too much. So there's a supplement that's gotten more attention recently. It's called Quercetin, and it's a flavonoid, and it has antiviral properties. And when you take vitamin C and Quercetin, it provides a synergistic antiviral effect. It works better. And so Quercetin is a natural supplement that helps get zinc into the cells too, like hydroxychloroquine does. So this is really good. You can get it over the counter. The dose is 500 milligrams daily for prevention, and then you can take it twice a day if you're sick. The next one to have in your toolkit is Famotidine or Pepcid. It's an over-the-counter histamine 2 blocker that blocks stomach acid production. This is the first one that's not just a supplement. It's a medication over the counter, and it's been really useful in COVID-19. There was an anecdotal paper found very early on from Wuhan, China, that noted that patients who survived COVID were more likely to be taking Pepcid. They've also done more studies in the hospital setting, and they found that there was decreased severity and intubation when Pepcid was used. So the dose is 40 milligrams twice a day if you're sick. There's so many things over the counter that I could mention. I'm trying to just kind of take the highlights for you. Take an aspirin, 325 milligrams a day when you're sick because you're more likely to form clots with COVID. Make sure you have a pulse oximeter and a thermometer on hand. You don't want to get sick and then think, I wonder what my oxygen saturation levels are, because that's one of the things they talk about. If it drops into the 80s, that's time to go to the hospital. So other things just to stay healthy, you can take a daily B complex vitamin, and then magnesium. B vitamins and magnesium, they help so many processes in the body. And my favorite way to get magnesium, because if you take it orally, you can get diarrhea. If you take an Epsom salt bath, it's magnesium sulfate. It just goes through your skin. 3 to 4 cups in your bath, and you're going to get great magnesium. One last item for your COVID survival kit is an iodine nasal wash. This sounds kind of funny, I guess, but they have some commercially prepared ones that you can just squirt up your nose. The virus loves to live, right here in your respiratory tract, and you can just kind of kill it with that iodine nasal wash. There's a little recipe on the slide if you want to make your own or just get the commercially prepared ones. And then if you don't like iodine, then you can also use colloidal silver, just straight. You can squirt that in as well. You can also swish it around as a mouthwash. I got a lot of these things from a document called Home-Based COVID Treatment from the AAPS online. And I will see if we can get it posted to this website. I found it to be a really good resource. And also, if there are medications like Ivormectin and Hydroxychloroquine that you would like to have in your toolkit and you can't find anyone to prescribe it for you, there are resources there of like telehealth places that you can go. I think it's not a bad idea if you look into those things and think they will be useful. I have found them to be useful. Then you can find a doctor and get your stash before you get sick. That's going to be the easiest way. So again, don't forget the basics. Eat healthy food, fruits and vegetables, stay away from processed food, get plenty of sleep, exercise, get out in the sun, decrease your stress levels. Obesity is a big factor in COVID. Lose weight. So many people are focused on the newest variant, but I propose that you need to focus on the host. Focus on yourselves. Get as healthy as you can be, and you'll be able to fight this thing. You got this.
Thank you, Doc. So, thank you very much. I really like the idea of Epsom salt bath. Does the insurance reimburse for that? Okay, so I just do want to clarify one thing that what these doctors mentioned. We physicians and the healthcare providers always have disagreement amongst ourselves. It doesn't mean that any one of us agree with anybody else's opinions or the prescriptions of the treatment. But there are some of the options which are available to consider, and please consult your physician, consult your nurse practitioner, or physician assistant, consult your healthcare provider to finally make a plan for yourself. But these are just some of the things. The other thing I would like to clarify is if you have a weaker immune system, none of us are really blaming you for that. We're just saying that work on your immune system, exercise, diet, some of the things which you guys have mentioned, right? Is that fair to say, right? Anyone else has a comment? Otherwise, in the interest of time, we would like to move forward.
Just a couple comments. Thanks, first of all, Dr. Keurentjes, for excellent advice. Appreciate it. Couple things to know. At this time of year, at our latitude, unfortunately, we don't have that much vitamin D occurring naturally. There's a great free app you can download for your phone. I assume everybody's got a phone. If you don't, then I'm surprised. It's called D-Minder, and it allows you to set goals and all sorts of fun things for vitamin D. But vitamin D is such a critically important vitamin, and we also know that the vitamin D that you take by mouth may work differently in your body than the vitamin D you acquire with sunlight. So take a look at D-Minder. You'll find at this latitude, at this time of year, we're mostly getting ultraviolet that will make D in your skin between like 11:30 and 1 o'clock or something. So just be aware of that. Therefore, it's a good idea to take supplemental vitamin D. You can spend all day outside on a sunny day like this in the winter and not get much vitamin D. The other thing, and I do not own stock in this company, but a pretty cool device for nasal washing is called Navage. I don't know if anyone's seen that. You can buy it online or at pharmacies, and it actually does a saline rinse. It pumps water in one nostril and sucks it out the other. And we know this virus comes in through your mucous membranes, and so if you want to avoid it or you think you might have been exposed, it might not be a bad idea to do the Navage with some povidone iodine. There was actually a study run in Reading earlier this year by Dr. Dome, one of our local ENTs, in conjunction with Stanford, where they were studying the povidone iodine or the betadine nasal washes, and I think the Navage device can make that a lot easier for people. So just a couple other little hints for you.
Thank you, Dr. Hamilton. Okay, I'm going to keep moving forward, right? Fast forward. Let's go. Next topic.